It is Sunday, May 17th, and welcome to our daily COVID-19 Task Force update. I'm Joe Delarone. I know it's a beautiful day, and lots of you are out there enjoying just the great weather, and certainly for those of you who are taking time to join us live here on Facebook, we welcome you along. Many of you will see it later, either on Kahnawake 911 or on Paul's Cable, or several different ways. I know people forward this as well. On today's program, we have one guest and one guest alone, and if we're going to have one guest, let it be a good one. So joining us today is Dr. Annick Gauthier.
Nyawa, Joe, no pressure, thanks. So today I'm going to have a couple of questions that have come in and end with a little bit of a demonstration. Some of you saw the photo that I posted on Facebook on this Kahnawake 911, so we'll see how it goes. So the first subject is pretty heavy for this sunny Sunday afternoon. So the question I got was, did a 5-year-old die of coronavirus in New York City from something called Kawasaki disease? Can you let us know if this is true? The article is very scary, and I want to know if this is true because you never know on Facebook what's true and what's not anymore. So I agree that it's hard sometimes on Facebook. You see things, and I'm going to talk a little later about something that's not true that's on Facebook. But this one actually is true. So the person who wrote the question sent a New York Post article, and it's an actual true article. I'm going to explain a little bit what Kawasaki is. They're also, just because you're going to hear different terms for the same type of disease. There's one called hyperinflammatory shock, atypical Kawasaki or Kawasaki, and then a very long one that's called pediatric multisystem inflammatory syndrome temporally associated with COVID-19. So what is Kawasaki? So Kawasaki actually came from Asia, and it was first diagnosed by Dr. Kawasaki, and it's an inflammation of blood vessels after you've had an infection, and it usually happens in children under the age of 5 years old. It's usually about 2 to 4 weeks post a viral infection. There are other causes of it as well. It's very rare, so it's usually like 10 to 20 per 100,000 children, so it's a really rare thing. So what we're talking about now in terms of COVID, it's less than 100 children overall in Europe and Canada, and a little bit more than that in the US. Now, the reason why we get very worried when we have a child diagnosed with Kawasaki is one of the complications, again, rare complication of a rare disease, is coronary artery abnormalities. So coronary arteries is the heart vessels. It can lead to dilation of the heart vessels or even a narrowing of the heart vessels. So what happens and what would the child present as? And so in a normal Kawasaki, it's usually you have 5 days of fever, and then you have a conjunctivitis, so red eyes, a rash on the body, no vesicles, so it doesn't look like chicken pox. You have one side of the neck has swelling. You have a tongue that looks like a strawberry, and it's bright red and often cracked lips. And then the hands and the feet get swollen. Now, with COVID-associated Kawasaki or atypical Kawasaki, you have some of these things, always the fever, more than 5 days, but it's not necessarily all of the rash symptoms. And sometimes you're actually just seeing signs of shock, so that's low blood pressure, confusion, and gastrointestinal symptoms like nausea and vomiting. And then by the blood, you see that you have low platelets, so that's something involved in coagulating the blood. Now, in terms of number of cases, so in Europe, there's been 10, as I understand it right now, in Italy. None of those 10 children, when they did the SARS-CoV-2 or the COVID-19 test in the nose, none of them were positive, but their family members were positive. So it's just associated with it. In the United Kingdom, so in England, there are 25 children that had this atypical Kawasaki, and one of them died. 40% of them, so a little less than half, had a COVID test that was positive, but all of them had antibodies against COVID in their blood. And again, this is happening after, 2 to 4 weeks after they actually had COVID. It seems to be associated with Europe and then the North America in the eastern seaboard. So what I mean by that is like New York City had like 150 in that area of the eastern part of the US, whereas there's only been 10 in the west coast of the US. In New York, there have been 2 deaths. And so that's what the person who wrote this question was. Yes, there have been 2 deaths that are associated with this atypical Kawasaki. In Montreal, between Saint-Justine and the Montreal Children's Hospital, they've seen 8 atypical Kawasaki. 1 of them presented with shock, so in quite serious condition. However, they responded very well to fluids and other treatments. And I'll talk about the treatments in a second. None of the people the children that have been found in Montreal are positive by the COVID test. They have kept the blood on hold to do the antibodies testing. And I'm going to talk about antibody testing a little later in the presentation. What's interesting is that no reports of this atypical Kawasaki related to COVID have been seen in Asia. And why that's interesting is that Kawasaki is actually more prevalent in Asia than it is in the regular Kawasaki than it is in the rest of North America and Europe. Now, I want to really stress that this is a rare condition. When a child is that sick, there's nothing, like you don't have to worry that your child, you will notice the child is sick. If you have a fever that persists for more than 5 days, go see your medical professional. If your child is really unwell, not responsive, you go to the emergency room, and I want you to go to a pediatric emergency room. How they treat atypical Kawasaki, and this COVID-related Kawasaki is really, one, dealing with, if the child is very sick, we deal symptomatically with how to help that child right then. But then we also give immunoglobulins, so a preparation of antibodies that are purified from other donors, and they're given to it. It's not a COVID-specific treatment. It is just a general antibody treatment, because the reason why Kawasaki or an atypical Kawasaki happens is because the body has an over-response. So it's the body, it's not the virus itself, it's the body's response to the virus causing an over-inflammation state. Also, what's given is low-dose aspirin. And then some of the children at Montreal Children's did need steroids as well to, again, reduce the inflammation. It's a scary thing. I know we get scared when we talk about our elderly being sick and our young children being sick, but this is a very rare thing. However, it goes to the fact of washing our hands, social distancing. Those are the key points for controlling this disease. All right, the second question is, I read that Canada has approved an antibody test. Can I get it? So unfortunately, the pictures in the media made this look like a pee on the stick test. I've talked about it before. If you think you're pregnant, if you're a woman, you pee on a stick and a little plus sign appears, and that's called a lateral flow assay. See, I'm educating you while I'm doing this. Well, this antibody test is not a lateral flow assay. It's a quite complicated test that can only be done in a lab, and a lab that has about $150,000 huge machine to run this. Now, what's very interesting and nice about this test that's been approved, and it's the only one that's been approved in Canada, all of the other pee on the stick lateral flow assays, and they're not pee, it's blood, but all of those like lateral flow assays, that even the ones that were initially approved in the US, and I know that some of you were able to buy them through different private labs in Montreal, all those have not been approved, and the federal drug agency has actually recalled them because they are not accurate, and I've talked about that before in Kahnawake 911. Now, this new test is made by a company called Diasorin. So the Diasorin test is interesting. It's in this huge machine. It actually quantitates, so it actually calculates how much antibody you have, and it's not just how much of that good antibody, what I've talked about, the IgG, but it's also how much neutralizing IgG, so how much of the antibody can actually stick onto the virus and eliminate it. So that's actually very interesting. However, this is a long way away from being used on a routine basis. Just for example, those kids that I talked about, the 10 kids in Montreal, they have to, like their blood is being weighted to actually go and be tested in this assay. So unless the lab owns that equipment, and from what I understand, that's not owned by any labs in Canada except perhaps one, it will not be a routine test. And so you cannot just send your blood to someone and test this assay. Again, if you see Facebook pop-ups, COVID screening, COVID antibody screening, sometimes they call it COVID serology because serum is blood, don't do that. Go and come to our testing center to have the nasopharyngeal swab of the COVID test. That's what's available right now. The third point is masks. And I'd like a little infographic going to appear on the screen shortly, because a lot of people have been sending this to me. Basically, and this is just one version of it, but there's a variety of versions where it has, a COVID carrier and then transfers to someone wearing a mask versus a COVID carrier with no mask, with a COVID carrier with both people wearing masks. And that general order is appropriate. The issue is the numbers underneath are not. So it's mostly false. And I would say when you see something on Facebook, a picture, something that just doesn't make sense, or even if you're thinking, oh, maybe it makes sense, but I want to check more into it, I highly recommend you look at something called Snopes.com, Snopes.com. So if you go into Snopes.com, and that's where I actually grabbed this graphic from, you can read, and they actually divide it into what's true, what's false, and what's undetermined. And that's how they present everything, not just related to COVID, that's how this group. So basically, what's true is the WHO, CDC, Health Canada, Quebec recommends wearing a cloth mask in public to help slow the spread of coronavirus, especially when you're in places that you can't be 2 meters apart. What's false is the percentages in this chart cannot be accurately determined at this time. We don't know that. It's a good idea, and it generally makes sense that if the person who has COVID is wearing a mask, that they would spread it less to someone who doesn't have COVID. We know that if they're both wearing masks, probably you have a little bit more protection. And then you know that if someone's in their house, because there's another graphic that has a person without a mask outside the house and someone inside the house, that you have pretty much no spread because you can't spread in that distance. But the actual percentages are not known. The next point I want to talk about is a re-entry regime. So we've talked a lot. I know Lisa and Lloyd and a variety of people have come up and talked about our revitalization strategy by the task force to gradually, incrementally open businesses. There's an article that's very interesting. You can just Google it. It's in the New Yorker. It's pretty easy to read. It's by a doctor called Atul Gawande. So yeah, it's sort of a complicated name. The last name is Gawande. He is a general surgeon. And why he's quite famous is, one, he's an excellent essayist. He writes essays regularly in the New Yorker on a variety of topics. He's written some books. But he also has this huge role with the WHO in reducing infections in surgeries around the world and creating these checklists, like in an airplane, the pilot and the co-pilot have a checklist of things safety-wise to go through. That's the exact same kind of thing that he's implemented across the world for surgeries. His writing, his speeches are very easy to read and very appropriate. And how he likens the re-entry system is to a drug cocktail. So I don't know if you have any friends that have HIV, but when a person has HIV, we give them a drug cocktail, so a variety of antivirals that target different aspects of the HIV life cycle so that we can control the disease. And he likens that our re-entry into society, our reopening, has to have a drug cocktail. The difference is there's no actual drugs involved. It's involved with human behavior. So the first, and I talk about this all the time, is hand hygiene. Washing your hands, and not just washing your hands, but washing your hands frequently. There's been studies done, and often as studies are often done, they're done in military cohorts because there's a group of people together and they really don't have much choice of saying yes or no to be part of the study. And they've shown that hand washing 5 times a day cuts medical visits for respiratory infections by 45%. Another study with the first SARS in 2005 showed that if you wash your hand 10 times a day, you reduce your people's infection rates even more. So really, hand washing is key and crucial in this. The second point is screening, so a daily screening for symptoms. So I don't know if some of the businesses have looked at the business packages, but one of the parts of the business package is an employee health check. At KMHC, we've been doing this health check now for over a month. I don't know, it seems hard to remember time before COVID, but we've been doing it for a really long time. And what you do is you grab your phone before you come in. All the employees that are working inpatient or home care, they enter into a website that Raymond Montour has generated for us. You go in there and you enter in if you have symptoms or not. If you have symptoms, it tells you what to do, where to get tested and so on, and who to call. That's the same kind of thing we'll be doing with the businesses. And this is what hospitals around the world are doing with all of their employees. And Dr. Gawande basically uses the hospital setting of the hospital as a way of reentry. Because remember, the hospitals haven't closed down. We've continued to work. And really, aside from the initial points in Wuhan, China, where there were outbreaks within hospitals, afterwards, through the combination of hand hygiene, screening, social distancing, masking, we've been able to have no infections that are spread within hospitals that have all those measures in place. So I went hygiene, screening, distancing, so 2 meters back. And 6 feet is actually just under 2 meters. I just want to say 2 meters is more like 6 feet 7 inches. If you can't be the 2 meters away, it's using masks. And then the fifth point, and I think this is really interesting and really nice for us, is that it's the culture. You have to create a culture where it's okay to remind people to adjust their mask or wash their hands, as well it's okay for them to stay home when they're sick. Now, I want to talk about the things. So, I have here, and from the Kahnawake Brewing Company, I have hand hygiene. So this is what you either wash your hands with soap and water, you use an antiseptic to wash your hands. You do that like 5 to 10 times a day. Every time you're going in and out of your house, you should have washed your hands before and after. If you can, keep this in your car or your purse or your man purse, your MERS, I think that's what it's called. Keep it on you so that you can wash your hands often, because that's what we often don't do. The next point, and cameraman, don't worry, I'm not going to hit the camera. I'm showing you what 6 feet is. So I'm 5'6". So look, this is just over 2 meters. Can you scroll up so you can see? Look at that. That's quite tall. Okay, and look, I'm standing 2 meters, 6 feet away from the camera. So I'm now pointing it right into the camera. So that's the second point. The next point is about masks. And I think everyone's seen some memes on the internet about masking. I wanted to actually bring up, and this is what goes back to the little promo photo that I listed, is I have my lovely doo-doo bag. So my oldest daughter, who's now going to be embarrassed, but she loved peanut butter, and she still loves peanut butter. And so much that I actually bought the little Kraft peanut butter. And yes, I'm only a Kraft peanut butter family. Okay, this is actually the crunchy peanut butter with the red bow tie. But you can see that this crunchy peanut butter Kraft bear is putting his mask on underneath his nose. And that's sort of like wearing your underwear down by your knees. That's not very useful. You also maybe see, and I just saw driving here today, I saw 4 people like this. But I didn't want to be late, so I didn't stop them. But normally I would stop because that's about changing culture, wearing the mask around their neck. That's like wearing your underwear on your feet. Not very useful. So I don't want you to be like the crunchy peanut butter bear. I want you to be like my good friend, the smooth peanut butter bear. So smooth peanut butter, I see he's wearing the green bow tie. He has the mask on properly, covering his entire face. He is even better because his hands are so short, he can't touch his face. I love that, okay? Again, we're not going to create Amelias and anyways, anyways, we're not going to go there with people and humans, but the whole point is you shouldn't be touching your face. You shouldn't be adjusting your mask. And then look, just like the mask, the underwear are on correctly. Oh, I undid the underwear with my hand, sorry. The underwear are on correctly. Now, the last point I wanted to make about masking is sides. So again, I don't want you to be using surgical masks. This is from our tool shed. When you put on a mask, if you are using a procedure mask, which you shouldn't be, you should be using one from cloth masks. The cloth masks have a side to them. Usually it's the patterned lovely side is on the outside. The same thing with a surgical mask. I'm not sure. Yeah, you can see. So it's blue. I'm going against my shirt. It's blue. And then the other side is white. Can you see that? So the white side is the side that goes against your face. I have not really touched anything throughout this time except for the bears that are already clean from my house that I just washed. I would have washed my hands, then you put it on over your ears. This is the only time you can touch your face. You take 2 index fingers and you go and pinch on the either side of your bridge of your nose like this. You do not do it with one hand. If you do it with one hand, your thumb has a way different pressure than your index finger. You need to use your 2 index fingers like this. And that's how you wear a mask. And that's how you, if you're going to wear a mask because you know that you can't be within 2 meters of someone, that's how you do it. But no matter what you need to do is wash your hands. And you need to be that 6 feet, 2 meters away from people. So thank you very much. And I wish you a lovely rest of your Sunday. Joe is going to come back to chat with you a little bit more.
I didn't know you could buy those Kraft peanut butter bears. That's pretty cool. I've known them all my life. Well, we'd like to thank Dr. Gauthier for that very interesting and informative presentation. And it's always nice to have her back here. For tomorrow, by the way, we'll have someone who hasn't been on the program before, Robin Montour. She is the Director of Operations for the COVID-19 Task Force office here, the Emergency Operations Center. She'll be joining us on the program. We'll also have a couple of other special guests that you'll like to meet. And also, I'd like to thank Raymond Montour for doing a good job here on the program yesterday, filling in. So that'll do it for us for today. And we welcome you to join us tomorrow for the daily update, and enjoy your planting day. And that's about it for us. So thanks. We'll see you next time. Nyao ko adano onigiwahi.